Welcome back. Hospitals in South Africa are battling to deal with rising patient numbers. Field hospitals in the Western Cape have taken the pressure off main facilities in trying to cope with the pandemic. At the same time, they're dealing with other illnesses. Today, we're taking a look at how nurses are keeping motivated at Cape Town's Hospital of Hope. That is at the Cape Town International Convention Centre. Watching that for us is eNCA reporter Ayesha Ishmail joining us live now from our Cape Town studio. So, Ayesha, let's begin first with what I was referring to there, hospitals battling with numbers. Where do we stand as far as the Western Cape is concerned?
Well, Thembekile, I had the opportunity to speak to the Western Cape Health Chief, or the CEO of the Western Cape Health Department here, Dr. Sadiq Karim, and he was telling me earlier that the first 100 days of the lockdown, this province actually used that opportunity to get its field hospitals in place. Now, we know that the Western Cape has 4 field hospitals, and the Cape Town International Convention Centre, which we know was famous for its banquets, for all its conferencing and jazz festivals that took place there, was then converted into the largest COVID-19 field hospital. And we've seen hundreds of patients going in there and coming out positively treated. Of course, there have been dozens of people that have died, but the health authorities were saying that they're very pleased with the recoveries that have taken place at the CTICC, dubbed the Hospital of Hope. And then, of course, there are 3 other field hospitals as well. There's one in Khayelitsha called the Tusong Centre. There's also the Brackengate Field Hospital, and also Soonstraal, which is for the patients coming from the Boerland area. So basically, what the Western Cape Health authorities have said, that they use the first 100 days during that hard lockdown to prepare for the infections, to prepare for when the Western Cape was going to reach its peak, and they believe that they've done very well. They say that they have enough beds, they have enough staff, they have Cuban doctors, they have voluntary nurses, and they were also talking about the fact that they've actually had a good, or still have a good relationship with the private sector, where they've had doctors, nurses, pharmacists and even administrative staff coming to the Western Cape Health authorities and saying, we would like to volunteer, we want to play our part to help during this pandemic. So in terms of the Western Cape, they're saying that they have enough beds available for now, they have enough health staff, and they have enough field hospitals to deal with the pandemic.
And Ayesha, I see you there battling with your earpiece. I won't keep you too long. Just on the peak, what are we hearing from the officials about whether it's come and gone, as some had suggested about a week or so ago? And if it's still coming, how sharp will it be?
Well, as the health authorities said about a week ago, they're saying that the peak's going to be flatter, it's going to be longer, it's going to be later. And according to Dr. Sadiq Karim, he's saying that he believes that we are now on the cusp of our peak, so the next 7 to 10 days will be very crucial.
eNCA reporter Ayesha Ishmail, thank you.